Hi, my name is Stephanie Otero, and I am the CEO of Feeding America Riverside San Bernardino, also known as FARSB, the largest hunger relief organization serving the Inland Empire, or the IE. Working at the food bank, I've seen the many faces of hunger and how devastating it can be to people's lives. In the past year, the COVID-19 pandemic put a spotlight on hunger as many families were faced with food insecurity for the first time in their lives. While hunger is now reaching unprecedented and historic levels, hunger has been a crisis in our country for a very long time. In fact, here in the IE, it is estimated that over 400,000 people are food insecure. Even more heartbreaking is that 1 out of every 4 children in our backyards don't have enough to eat. What I've learned at my time at the food bank is that hunger is not the result of lack of food. In fact, there is more than enough food to feed everyone in our country. Rather, what causes food insecurity is the lack of access to food, which can be caused by many underlying and complex factors, including poverty, job instability, lack of housing, lack of health care, and other inequities. Our mission at the food bank is to end hunger in our community. What we've realized long ago is that just feeding people won't end hunger. Trying to cure a symptom rather than the underlying condition is just temporary. To mitigate food insecurity, we need to focus on the root causes of hunger. Even though there are no quick fixes to poverty, lack of housing, or lack of health care, we can be proactive rather than reactive. And one of the ways in which we can be proactive is by creating resilience to food insecurity. Resilience is defined as the capacity to recover quickly from difficulties. In other words, we need to make food accessible to those facing food insecurity quickly and easily. This will provide them with the ability to focus their time, attention, and resources on other areas so that being hungry doesn't impede their ability to thrive. Getting food to the people who need it sounds easier than it is. There are barriers that prevent people from getting the help they need. Such barriers can include lack of awareness, lack of transportation, lack of availability, and negative stigma attached to receiving assistance. Stigma just might be the biggest barrier that we face. Asking people for help when you need it is a humbling experience. It can make you feel ashamed and embarrassed. It often causes people who need help to go without, regardless of the ramifications on their health or their lives. I'd like to tell you the story of a little girl. This little girl was born in a rural farming town in New Mexico. She was impoverished and the daughter of a teenage mother. She was accustomed to eating 1 to 2 times a day until she attended school. Fresh fruits and vegetables were not a part of her diet. Instead, her meals at home consisted mostly of rice, potatoes, and beans, items that could be purchased in bulk and that were inexpensive. As a child, she didn't notice the inequities. She didn't realize she was poor, but as she got older and attended elementary school, she soon started to see the differences. For example, at her friends' slumber parties, she noticed that their refrigerators were full of food and their pantries were stocked with snacks. At school, she noticed that not all of her classmates got a ticket for a free lunch. Instead, they brought lunch boxes packed with homemade peanut butter and jelly sandwiches, milk, and apples. This made her feel embarrassed and ashamed. When she reached high school, and in order to avoid the embarrassment of getting a free lunch, she started to skip lunch altogether. She preferred being hungry rather than feeling shame for getting a free lunch. I understand firsthand the negative stigma attached to being food insecure because that little girl was me. But because of my experience, I also understand the importance of giving assistance with dignity and making people feel like they are getting a hand up rather than a handout. So how do we start to tackle this stigma so that we can strengthen our community's resilience to food insecurity? We can begin by changing the narrative. Changing the narrative can be done by recognizing that hunger is complex. People aren't born hungry. They become food insecure based on a variety of factors, circumstances, and inequities. When we begin to understand this, we can truly begin to initiate change. We can also listen to understand and listen with empathy. When we do this, we can gain insight on how to better assist. We can learn what barriers they face that prevent them from getting the help they need. We can also co-author agendas and collaborate. We are stronger together by combining our resources. Our community will thrive when we begin to not only focus on food, but also on housing, health, and jobs. Collaboration is key to creating a thriving IE. We can also be the voice for those in need. I wish that I had someone fighting for me when I was a little girl. By being the voice for those in need, we can advocate. Public policy is the key to making essential resources available to all, thus preventing food insecurity before it begins. Overcoming food insecurity is no simple task, but it can be overcome. I'm living proof of it. As a community, we can work together to change the narrative and advocate for those who cannot advocate for themselves. Together, we can and we will solve hunger, and we can create a community where everyone thrives. Thank you.